Hey everyone, welcome back. Ready for another deep dive. Today we're tackling a topic that I know is on all of your minds as medical microbiologists.
Oh, definitely.
Gonococcal infection.
It's everywhere.
It really is.
Okay.
It's one of those infections that just keeps us on our toes,
Right.
right? Because it's so common, but increasingly a challenge to treat,
Absolutely.
especially with the rising antibiotic resistance.
For sure.
So to guide our deep dive today, we're turning to a crucial resource, the World Health Organization's 2021 publication, AWARE. Access, Watch, Reserve.
Ah, classic.
Yeah, and we're zeroing in on Chapter 20.
The one on sexually transmitted infection.
Exactly, specifically focusing on gonococcal infection.
Right.
We're going to break down the latest guidance on everything from diagnosis to treatment, and of course the global challenge of antimicrobial resistance.
So that's a big one.
It really is. But before we jump into all of that, let's start with the basics. Can you give us a clear definition of what exactly a gonococcal infection is? Just to make sure we're all on the same page.
Sure. So in a nutshell, a gonococcal infection is a sexually transmitted infection caused by the bacterium Neisseria gonorrhoeae. This bacteria, it primarily infects the mucous membranes of the reproductive tract.
Okay.
But it can also affect the rectum, the throat, and even the eyes.
Yeah, that's what makes it so tricky. It can really show up in a lot of different places. And that brings up a point that I always find fascinating. The fact that this infection, especially in women, can be completely silent.
Oh yeah, asymptomatic cases are a huge challenge.
How common are we talking?
More common than you'd think, especially in women, and that's why it spreads so easily.
Because people don't even know they have it.
Exactly.
Right.
They might not have any symptoms, or the symptoms could be so mild that they're easily missed.
So it just keeps on getting passed along.
Exactly. And then you have the issue of the symptoms overlapping with other infections like chlamydia.
Oh, that's right. You can't just assume it's one or the other.
You gotta test for both.
Makes sense.
Yeah.
So speaking of symptoms, what are the red flags that we should be looking out for?
Well, for men, the classic presentation is acute urethritis. So you'll see discharge, they'll complain about painful urination, sometimes even some testicular discomfort.
Got it. And what about for women?
In women, it can be a bit trickier. The symptoms can be more subtle. You might see vaginal discharge pain during urination, lower abdominal pain, which could be a sign of pelvic inflammatory disease.
Oh, pelvic inflammatory disease.
Yeah.
Sounds serious. What kind of long-term problems can that lead to?
Well, the big one is infertility.
Oh, wow.
If pelvic inflammatory disease is left untreated, it can cause scarring of the fallopian tubes, which can then block the passage of eggs.
That's a really good reason to catch this early.
Definitely. Early diagnosis is key.
So we've talked about urethritis.
Yeah.
We've talked about pelvic inflammatory disease. What are some of the other ways that gonococcal infection can present? Those less common presentations that we need to keep on our radar?
Well, you can see proctitis, pharyngitis, even conjunctivitis.
Wow, so it can really go anywhere.
Pretty much. And those can be easy to miss, especially if the patient doesn't think to mention certain sexual practices or doesn't have any noticeable symptoms.
You got to ask the right questions.
For sure. And then there's the rare but serious disseminated gonococcal infection.
That's the one that can spread to the joints and the skin, right?
Exactly. Even the heart. That's a whole other ballgame.
Yeah, definitely a reminder to stay vigilant. Okay, so let's say we suspect a gonococcal infection. How do we confirm it? What are the essential lab tests for medical microbiologists?
Well, the gold standard these days is nucleic acid amplification testing, or NETSATs.
RIETs.
Yeah. They're incredibly sensitive and specific because they can detect even tiny amounts of N-gonorrhea DNA.
So are we talking about like PCR?
Yeah, similar concept.
So basically NETs have taken over from the old school culture methods.
For the most part, yes. Cultures can be finicky with N-gonorrhea, and they take a lot longer to get results. NATs give you a faster, more reliable answer.
That makes sense. And in terms of samples, what kind of samples work best with NETs?
You can use urine, but it can be a bit less reliable in women.
Okay.
So we usually go for urethral swabs, vulvovaginal swabs, cervical swabs, rectal swabs, depending on what we're looking for.
So there's some flexibility there. What about microscopy? Does the good old Gram stain still have a role to play in diagnosing gonococcal infection?
It can be helpful for a quick presumptive diagnosis, especially if you see those classic Gram-negative diplocacci inside white blood cells.
Ah, the classic coffee bean appearance.
Exactly. But you can't rely on microscopy alone.
Why not?
Well, it just doesn't have the sensitivity and specificity of gnats. You could easily miss cases, especially those with low bacterial loads.
So you can get a false negative.
Exactly. So you really need to confirm with the net.
I got it. Now, would you ever order blood cultures for a suspected gonococcal infection?
Oh, absolutely, if I suspected disseminated gonococcal infection.
Makes sense. You'd need to know if it's spread to the bloodstream.
Exactly. That's when blood cultures become crucial.
Okay, so we've talked about the lab tests. Let's shift gears and zoom in on the culprit itself, Neisseria gonorrhoeae. What makes this bacterium such a tough opponent from a microbiological perspective?
Well, it's a gram-negative coccus, for starters, and it has this incredible ability to develop resistance to antibiotics.
It's like it's always one step ahead.
It really is. It's constantly evolving, which is why it's so hard to treat and why it's such a major public health concern.
Speaking of public health, the WHO actually launched a global action plan to combat antimicrobial resistance in gonorrhea back in 2012.
Yeah, they recognized how serious this problem was becoming.
Definitely. And it seems like it's only gotten worse since then. So how do we keep up with the ever-changing resistance patterns?
Well, luckily, the WHO has established some really helpful surveillance systems.
Oh, okay. Like what?
Like GLS, the Global Antimicrobial Resistance and Use Surveillance System. It tracks resistance patterns worldwide, giving us a global picture of what's going on.
So we can see where resistance is emerging and spreading?
Exactly. And then there's GSP, the Gonococcal Antimicrobial Surveillance Program, which focuses specifically on gonococcal resistance.
So it's like a specialized task force.
Yeah, it provides critical data on what strains are circulating in different regions and what kind of resistance they have.
Essential tools for anyone managing gonococcal infections.
Absolutely. You need to know what you're dealing with.
Now, besides the microbiology tests, are there any other lab tests that are routinely used for diagnosing gonococcal infection?
Not really. Microbiology testing, particularly NATs, is really all you need for a definitive diagnosis.
And what about imaging?
Imaging isn't usually necessary unless we suspect complications like pelvic inflammatory disease or disseminated infection.
So if it's straightforward, you can skip the imaging.
In most cases, yes.
Okay, so let's move on to treatment. Then we'll talk about the antibiotics in more detail.
Sounds good.
What's the most important thing for our listeners to remember when they're managing a patient with a gonococcal infection?
Treat every diagnosed case, even the asymptomatic ones.
Even if they don't have any symptoms?
Even then. Because untreated infections, they can lead to serious complications for the patient, and they also contribute to ongoing transmission in the community.
It's a public health issue.
Exactly. So we need to treat everyone who tests positive.
Okay, so how do we tackle this? What does the WHO recommend?
The WHO guidelines really stress the importance of tailoring treatment based on local resistance patterns.
So you can't just use a one-size-fits-all approach?
Nope. You got to know what's circulating in your area.
Makes sense. And if you don't have reliable resistance data, what do?
Then dual therapy is the preferred approach.
Dual therapy, meaning 2 antibiotics.
Exactly.
And what does that look like?
So the first-line option is a single intramuscular dose of 250 milligrams of ceftriaxone combined with 1 gram of azithromycin given orally.
Ceftriaxone and azithromycin.
Yep.
Okay. And is there a second-line option if that's not feasible?
Yes. The second-line choice is 400 milligrams of cefixime orally, also paired with 1 gram of azithromycin orally.
So again, a dual therapy approach. Now, are there any situations where single therapy is acceptable?
Yes, but only if local resistance data strongly support it. And even then, you have to be really careful.
Okay, so in those specific cases, what are the options?
You could go with 400 milligrams of cefixime orally, or 250 milligrams of ceftriaxone intramuscularly, or 2 grams of spectinomycin intramuscularly.
So those are the single therapy options if and only if the resistance patterns allow it.
Right. It's all about choosing the right weapon for the battle.
And speaking of weapons, could you just run through those dosages one more time just to make sure everyone's on the same page?
Sure. So for dual therapy, it's either ceftriaxone 250 milligrams intramuscularly as a single dose.
Okay.
Plus azithromycin 1 gram orally, also a single dose.
Got it.
Or cefixime 400 milligrams orally, single dose.
Okay.
Again, with azithromycin 1 gram orally, single dose.
All right. And for single therapy, if resistance patterns allow it?
Then your choices are cefixime 400 milligrams orally, single dose, or ceftriaxone 250 milligrams intramuscularly, single dose, or spectinomycin 2 grams intramuscularly, single dose.
Okay, so lots of options. But it's important to remember that these dosages are based on normal kidney and liver function, right?
Absolutely. If a patient has any kind of renal or hepatic impairment, you might need to adjust the dose.
Always got to consider the individual patient.
For sure.
Now, what happens if a patient doesn't get better after treatment? What should we be thinking about?
Then you have to consider treatment failure.
Like the antibiotics just didn't work.
That's one possibility. It could be due to resistance to the antibiotics you chose.
Okay.
Or it could be that the diagnosis was wrong in the first place.
So you might need to go back and reassess.
Exactly.
Now, are there any specific things to keep in mind when treating oropharyngeal infections or gonococcal ophthalmia neonatorum?
Yes, the approach can be a bit different. For oropharyngeal infections, the same dual therapy options we discussed apply.
Okay.
But for gonococcal ophthalmia neonatorum, we typically use a single intramuscular dose of 50 milligrams per kilogram of ceftriaxone.
And of course, with neonates, you always have to adjust the dose based on their weight.
Absolutely. Precision is key.
All right, so we've covered the what and the how, but let's delve into the why. How does gonorrhea actually cause infection? Walk us through the process.
Okay, so it all starts with attachment.
Attachment.
Yeah. Gonorrhea uses these little hair-like structures called pilia and other surface proteins to attach to the mucosal lining, usually in the genital tract.
So it latches on.
Exactly. Then it invades the cells, starts to multiply, and triggers an inflammatory response.
And that's what causes all the symptoms.
Exactly.
Now, how does this sometimes progress to more serious complications like pelvic inflammatory disease?
Well, if the initial infection isn't contained, gonorrhea can actually move further up into the reproductive tract.
Oh, no.
Yeah, and in women, this can lead to pelvic inflammatory disease where the infection spreads to the uterus, fallopian tubes, and ovaries.
And that's what can cause chronic pain scarring and infertility.
Exactly.
And what about those rare cases of disseminated gonococcal infection? How does that happen?
In those cases, gonorrhea actually breaks through the mucosal barriers and enters the bloodstream.
Oh, wow.
Yeah, it can then travel to different parts of the body, causing all sorts of problems.
Like arthritis and skin lesions.
And even endocarditis, which is an infection of the heart valves.
So this little bug can really pack a punch.
It definitely can. You don't want to underestimate it.
Now, you mentioned earlier that gonococcal infection can also be transmitted to newborns during delivery.
Right.
What are the implications of that?
Well, if a mother has an untreated gonococcal infection, it can be passed to the baby during childbirth.
Oh, no.
Yeah, and that can lead to gonococcal ophthalmia neonatorum, which is a serious eye infection.
And that can cause blindness.
Right. It can if it's not treated promptly. It can also cause pharyngitis and sometimes arthritis in newborns.
So the stakes are really high.
Absolutely. Especially for these vulnerable populations.
Let's zoom out a bit and look at the global picture. What can you tell us about the epidemiology of gonococcal infection? How big of a problem is this worldwide?
It's a massive problem. The WHO estimates that there were 82 million new gonococcal infections in 2020 alone, just among adults aged 15 to 49.
Wow, 82 million. That's a staggering number.
It is, and the highest incidence is in the African and Western Pacific regions.
Really?
Yeah, but it's important to remember that this is a significant public health issue everywhere.
So what are some of the risk factors for getting a gonococcal infection?
Well, there are several factors that come into play. HIV infection is a big one. Younger age having multiple or new sexual partners, a history of other STIs.
Got it.
And then there are some socioeconomic factors that can increase the risk.
Like what?
Things like poverty and substance abuse.
So it's a complex interplay of individual behaviors and broader societal factors.
Exactly.
Now, when we talk about the most likely pathogens in this context, it's always Neisseria gonorrhoeae.
That's right. But the real challenge is that there are different strains of gonorrhoea with different resistance profiles.
So some strains are more susceptible to certain antibiotics than others.
Exactly. And those resistance patterns can vary from region to region.
That's why those WHO surveillance systems are so important.
Absolutely. They help us track those changes and tailor treatment accordingly.
So we're not just shooting in the dark.
Nope. We're using the data to guide our decisions.
Okay, ready for a little quiz to test your knowledge?
Hit me with it.
All right, true or false? Gonococcal infection always presents with clear and obvious symptoms.
False. We've talked about this. Asymptomatic cases are a big problem, especially in women.
Next question. What's the gold standard for diagnosing gonococcal infection?
That would be not.
It is. Question number 3. Why is dual therapy often the preferred approach for treating gonococcal infection?
Because it helps prevent the development of antibiotic resistance.
Exactly. It's all about hitting that bacteria with 2 different mechanisms of action. All right, question 4. Which of the following is not a typical symptom of gonococcal infection in men? Acute urethritis, discharge, dysuria, or vaginal discharge?
Vaginal discharge. That's more common in women.
All right, last question. What are some key elements of preventing gonococcal infection?
Comprehensive sexuality education, promoting condom use, and partner notification and treatment.
Excellent. You aced the quiz.
Ooh, I do this for a living.
Fair enough. So we've covered a lot of ground today. But we're not done yet. In the next part of our deep dive, we'll explore the implications of rising gonococcal resistance and discuss some of the emerging treatment options.
It's going to be a fascinating discussion.
I can't wait.
Me neither. #TTS, the deep dive episode 2024-1206, part 2 of 3. So, as we've seen gonococcal infection, it's not just a simple infection.
It's definitely not.
It's complex, it's constantly evolving.
And we're constantly playing catch up.
Right, we have to adapt our strategies all the time.
Yeah. And speaking of adaptation, you mentioned the WHO's aware classification system for antibiotics earlier.
Oh, yeah.
Seems like a really relevant framework here.
Absolutely. The aware classification, access, watch, and reserve, it's all about optimizing antibiotic use.
And combating resistance.
Exactly.
So how does this system actually work? Like in the real world, how do we apply it?
Okay, so think of it as a tiered system.
Okay.
The access group, it includes those antibiotics that are widely available, affordable, generally effective for those common infections.
They're like the workhorses.
Yeah, our first-line choices.
So where do our go-to treatments for gonococcal infection fit into this? Like ceftriaxone and sufixime.
Good question. So those fall under the watch category.
Watch.
Yeah, it's a step up in terms of caution.
What does that actually mean? Like, what does it mean for how we use those antibiotics?
It means they're still effective for now.
Okay.
But we need to be extra careful with them.
Because resistance is emerging.
Right. We have to monitor the situation really closely to make sure they stay viable options.
So it's like a yellow light.
Yeah. Not a red alert yet, but definitely something to keep an eye on.
Got it. And what about the reserve category? What kind of antibiotics are in that group?
The reserve antibiotics, those are our last resort.
The big guns.
Exactly. We save those for the situations where nothing else works or when resistance is widespread.
They're precious.
They really are. We need to protect them to make sure they're there when we absolutely need them.
It's a reminder of how fragile this whole system is.
It really is.
Now, I'm curious. The WHO document also talks about gonococcal infection in pregnant women.
Right.
What are some of the special considerations there?
Well, pregnancy adds another layer of complexity.
I bet.
Because untreated infection during pregnancy, it can pose risks for both the mother and the baby.
What kind of risks?
Well, for the mother, it can increase the risk of miscarriage, premature labor, low birth weight.
Oh, wow.
And for the baby, as we discussed earlier, transmission during childbirth can lead to that gonococcal ophthalmia neonatorum,
Right.
which can be really serious for the baby's eyesight.
So early intervention is even more important in these cases.
Absolutely. You want to prevent those complications if at all possible.
So what does that mean for testing and treatment in pregnant women?
The WHO recommends screening all pregnant women for gonococcal infection.
Regardless of symptoms.
Yeah. Better safe than sorry.
And the antibiotics we typically use, ceftriaxone and sufixime, those are generally safe to use during pregnancy, right?
They are. But you always have to consider the individual patient, their medical history, any potential allergies. It's crucial to consult those up-to-date guidelines.
To make sure you're making the best decision for both the mother and the baby.
Exactly.
The document also mentioned a link between gonococcal infection and HIV.
Oh, yeah.
Can you talk a little bit more about that connection?
Sure. So gonococcal infection, it can actually increase the risk of both acquiring and transmitting HIV.
Really?
Yeah. The inflammation that it causes in the genital tract, it creates a more favorable environment for HIV to enter the body.
So it's like it makes it easier for HIV to get in.
Exactly. And if someone already has HIV, a gonococcal infection can increase their viral load.
Making them more infectious.
Right.
Wow. It's a reminder of how interconnected these STIs are.
It really is. And it highlights the need for that comprehensive sexual health care.
We can't just focus on one infection. We have to look at the whole picture.
Exactly.
Now, the document makes it pretty clear that there's no vaccine for gonococcal infection on the horizon.
Not yet, anyway.
So what are the best ways to prevent this infection right now?
Well, prevention, it involves several different strategies.
Okay.
Education is always the foundation.
Right. We need to talk about it.
We have to have open, honest conversations about STIs, risk factors, prevention methods.
So comprehensive sexuality education.
Exactly. We need to empower people to make informed decisions about their sexual health.
And condoms are still one of the most effective methods.
Absolutely. Condoms are a great barrier method.
But we know that people don't always use them consistently.
That's true. And that's why partner notification and treatment are so important.
Right. So if someone tests positive, their partners need to be notified.
And treated.
Even if they don't have symptoms.
Even if they don't, because they could still be infected and spreading it.
It's about breaking that chain of transmission.
Exactly.
Now, there's a part of the WHO document that I found really fascinating, the section on global surveillance of gonococcal antimicrobial resistance.
Yeah.
It seems like such a crucial effort, but it doesn't always get the attention it deserves.
I agree. It's a lot of work, but it's absolutely essential for staying ahead of this evolving threat.
So the WHO has really been leading the charge on this.
They have. They've played a key role in establishing these robust surveillance systems.
To track those resistance patterns worldwide.
Exactly. It's a massive undertaking, but it's really paying off.
You mentioned GLASS and GASP earlier. Can you remind us how those systems work and why they're so important?
Sure. So GLASS-Day, the Global Antimicrobial Resistance and Use Surveillance System, it collects data on resistance from labs all over the world.
So it's like a global database?
Yeah, it gives us a big picture view of what's happening, where resistance is increasing, and what types of resistance are emerging.
And then GASP focuses specifically on gonococcal resistance.
Right. It's a network of sentinel sites that collect and analyze N-gonorrhoea isolates.
So it's like a specialized intelligence unit.
Exactly. And it provides really detailed information on the prevalence and types of resistance in different regions.
So we can target our interventions more effectively.
Exactly.
It's amazing how much data we're able to collect now.
It really is. And it's all thanks to the WHO's efforts.
It's a great example of global collaboration.
It really is. When it comes to fighting antimicrobial resistance, we're all in this together.
We've covered so much ground already.
We have.
From diagnosis and treatment to prevention and surveillance.
It's a lot to take in.
But the story doesn't end here.
Not at all. In the final part of our deep dive, we're going to tackle the big question.
What does the future hold for managing gonococcal infection?
Exactly. Especially with this rising resistance.
We'll explore those emerging solutions that you mentioned and hopefully leave our listeners with some food for thought.
I'm looking forward to it. #TTS, the deep dive episode 2024-1206, part 3 of 3.
Okay, so we've talked about diagnosis, we've talked about treatment, we've talked about the importance of global surveillance. But looming over all of this is this issue of rising antibiotic resistance.
Mm-hmm.
What happens if our current treatments just stop working?
That's the nightmare scenario, isn't it? If N-gonorrhoea develops widespread resistance to the antibiotics that we have now, we're talking about a major public health crisis.
It doesn't bear thinking about.
Untreatable gonococcal infections.
Yeah.
Serious complications. Increased transmission rates. It would put a huge strain on healthcare systems.
It's scary to think we could be heading back to a pre-antibiotic era, where a simple infection could have devastating consequences.
I know. It's a real possibility. And it wouldn't just affect individuals. We're talking about whole populations, potentially decades of progress in sexual and reproductive health just wiped out.
So what can we do to prevent this? What's on the horizon? What are some of the solutions that are being explored?
Well, there's a lot of research going on, which is encouraging.
That's good to hear.
Scientists are working really hard to develop new antibiotics that can overcome those resistance mechanisms that N-gonorrhoea has developed.
So it's like a constant arms race.
It really is. We have to outsmart the bacteria.
What else is being investigated?
Well, we're also looking beyond traditional antibiotics.
Oh, interesting. Like what?
There's a growing interest in antimicrobial peptides.
Antimicrobial peptides?
Yeah. They're part of the body's natural defense system.
Oh, wow.
They have broad-spectrum antimicrobial activity, and what's really promising is that bacteria, they seem to have a much harder time developing resistance to them.
So it's like harnessing the power of our own immune system.
Exactly.
Are there any other kind of out-of-the-box approaches that are being researched?
Yeah, there's phage therapy.
Phage therapy.
It sounds a bit like science fiction, I know.
It does.
But it's an old concept that's making a comeback.
How does it work?
So phages are viruses that infect and kill bacteria, and we can actually use them to target and destroy drug-resistant N-gonorrhoea.
So it's like a virus versus bacteria showdown.
Exactly. And what's really cool about phages is that they can evolve along with bacteria.
So they can keep up.
Right. It makes it harder for resistance to develop.
It's like a self-updating antibiotic.
Exactly.
Are there any other innovative approaches in the pipeline?
Well, the ultimate goal would be a vaccine against N-gonorrhoea.
Oh, wow. That would be amazing.
It would, but it's been a huge challenge.
Why?
Because the bacterium is constantly changing its surface proteins, so it's really hard for our immune system to mount an effective response.
So it's like trying to hit a moving target.
Exactly. But researchers are making some progress.
Well, good to hear.
They're identifying potential vaccine targets.
Okay.
And they're exploring some new vaccine technologies that might just be able to overcome these challenges.
Fingers crossed.
I know, right?
But in the meantime, while we wait for these new solutions to become available, what can we do right now to tackle the problem of antibiotic resistance?
Well, it comes down to responsible antibiotic stewardship.
What does that mean exactly?
It means prescribing antibiotics only when they're really necessary, not for viral infections or conditions where they're not going to be effective.
So using them appropriately.
Right. And it also means educating patients about the importance of taking their full course of antibiotics.
Even if they start feeling better.
Even then. Because if they don't finish the course, it can contribute to resistance.
And of course, prevention is key.
Absolutely. Preventing infections in the first place, that reduces the need for antibiotics, which in turn helps to slow down the spread of resistance.
It all comes back to those prevention strategies we talked about earlier. Education, condom use, partner notification.
Right. It's a multi-pronged approach.
We need individual responsibility, public health initiatives, and research all working together.
We all have a role to play.
So before we wrap up, what's a final thought-provoking question for our listeners?
How about this? Given the threat of antibiotic resistance, what steps can you take in your own practice to make sure that antibiotics are being used wisely?
A call to action for all of our medical microbiologist listeners. Excellent. And where can our listeners find more information about gonococcal infection, antibiotic stewardship, and the WHO's recommendations?
The WHO's Aware Access Watch Reserve document is a fantastic resource.
Okay.
It provides really comprehensive guidance on managing antibiotic resistance. And not just for gonococcal infection, but for a whole range of infections.
It's a must-read.
Absolutely. It's available online.
Perfect. And as healthcare professionals, it's our responsibility to stay informed, to advocate for responsible antibiotic use, and to work together to protect the health of our patients and our communities.
Couldn't agree more.
Well, it's been a pleasure diving into this topic with you.
Thanks for having me.
And to all our listeners out there, thanks for joining us on this deep dive into the world of gonococcal infection. Stay curious, and we'll catch you next time.